Great. So next, it's my honor to introduce the leader of one of the organizations who has been way out in front of this. The Institute of Medicine is one of the real jewels in the crown of the U.S. healthcare system and indeed the world. The number of times that when the IOM puts out a report, when they do their due diligence, when they kind of take a stand on an issue, it means something. It has an impact that is so profound and impactful that we're still 10 years later quoting their reports on patient safety. 10 years later, we're quoting their reports on the time it takes for learning to shift from publication to the clinic. The IOM, when they take a stand, it matters, and they have taken a stand on data. They are firmly in the camp of opening data and bringing it to all of us to be a catalyst. So it is my pleasure and honor to introduce Dr. Harvey Fineberg from the IOM.
Greetings, everyone. I'm Harvey Fineberg, president of the Institute of Medicine, and it is absolutely a thrill to be part of this enterprise once again. Nothing so well symbolizes the exponential growth in the number of apps, in the utilization of data, and in the energy behind Datapalooza than the Health Data Collegiate Challenge that we call Go Viral to Improve Health. This is a program that the Institute of Medicine and the National Academy of Engineering jointly undertake to promote effective and imaginative creation of real applications from available data by college students around the country. It's a challenge that went out to hundreds of schools, more than 50. Teams were assembled from universities around the country with their faculty advisors, working to create apps, identify a health problem, utilize the data that was available, develop the app that would actually solve the problem and show us how and why it would work. Over the past year, we've had a wonderful team of judges who were able to look at these submissions and to select the winners that we are so proud to be able to present to you today. Let me for a moment just acknowledge and thank the individuals who did serve as judges this year, starting with Todd Park, CTO of the USA, who served as a judge, Deborah Estrin, professor at UCLA and a member of the National Academy of Engineering, and we're so pleased throughout this program, last year and this, that we've been able to partner with the National Academy of Engineering in organizing, mounting, and carrying out this program. Barbara Reimer, who is a professor at the UNC Chapel Hill and a member of the Institute of Medicine, also was a judge. Rena Singhal Lee of Android Engineering, where she serves as the Senior Technical Manager at Google. And finally, it's a pleasure to also acknowledge as a judge and a sponsor of this year's award, Richard Merkin, who is the CEO of the Heritage Provider Network. Please join me now in welcoming and congratulating Richard Merkin for his role in sponsoring and supporting this year's Collegiate Challenge. Richard, congratulations and thank you.
Thank you. I'm Richard Merkin, and I'm the founder and president of the Heritage Provider Network, which is an integrated medical group in California, in New York, and in Arizona. It is with such pride that I was able to work with the Institute of Medicine and the National Academy of Engineering. There is so much talent in this country. The individuals that won this and entered this contest are not only important to America, important to society, but important to the world. There's so much outstanding technological innovations, creative destruction. I am just so proud to be affiliated and hope in the future to be involved in more such challenges. As an example, we do have a $3 million Heritage Prize, which is developed about 1 year ago to develop predictive modeling to project and who will be hospitalized in any given patient population in the next year. What is interesting is I am a physician, but there are very few physicians involved. There are 13,000 teams involved. The leader so far is a physicist from MIT, a hedge fund operator from Florida, and a data miner from Australia. This healthcare is becoming an information science, and the leaders today in predictive modeling and the future of medicine will be more data analysts besides the physicians that take care of patients on a daily basis. So now I would like to introduce the project leader from the National Academy of Engineering to announce the winner, Proctor Reid. Thank you.
Thank you, Dick. Thank you, Dr. Merkin. Now, to announce the winners of the 2012 Go Viral to Improve Health Collegiate Challenge. This year's third place team is Healthy State from Indiana University. Congratulations to team members Michelle Deggs, Matthew Holfellner, Mukta Gundi, Pranav Gupta, and Anthony Monaco. Healthy State is an app that transforms publicly available data into usable visualizations and information about the overall health of the population of each of the 50 states. So, again, congratulations to you all. Good. Over your award. So, let me shake your hands. Good. For you, Matthew. Congratulations. Thank you.
Thank you.
Thank you. Not for you, that's right, excuse me. Hi. Looking down, that's right. Good. Thank you. All right. All in order. I was about to give Dr. Merkin an award. The second place award goes to Raise Awareness from Rose-Hulman Institute of Technology in Indiana. Please welcome team members Spencer Fox, Aaron Wilson, and Mark Vital. Okay. Ray Awareness prevents the skin damage from UV radiation by harnessing the power of social media through calendar integrations, push notifications, and data streamed from various sources. So, gentlemen. So, get it right. I'll get you the right badge here. Aaron. Okay. Pull that apart. One apiece. One apiece. And there you are, Mark. Good. All right. Great. And this year's grand prize winner is Vaccination, a team of students from Rice University and Baylor College of Medicine. Please join me in congratulating Hashim Zaidi, Emma Corbett, Ronnie Wren, Peter Camel, and George Chen. Right here. Good, 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 good. Good. Come closer here. Let me see. Good. There you are, sir. Congratulations. And just the right number. Good. Good, good, good. Here, one more. Great. Great. Now, I'd like to invite the team from Vaccination now to tell us a little bit more about their winning app.
Thank you so much for this wonderful opportunity. My name is Emma Corbett, and this is Peter Kamel. He will also be helping us with the presentation today. On behalf of all of the team, I wanted to let you all know how honored we are to receive this award and how truly delighted we are to be here. I wanted to open up by asking a few questions. How many of you could provide immediate, comprehensive, up-to-date vaccination records if you were to transfer to a new physician or start a new job? How many of you know the date of your child's last tetanus shots should they accidentally step on a nail? I see a few hands, that's very good, but you're in the minority. Keeping up with vaccination requirements and maintaining these records is difficult, especially for families with multiple children or those who lack consistent primary care. I'm sure a lot of the parents in the audience here today can identify with how complicated it can get following the CDC's immunization schedule, as you can see on this slide. Vaccines, as you all know, are the single most important prevention of many deadly diseases. For example, with the advent of the measles vaccine, we were able to reduce the number of annual cases of measles from 2 million to only 62 cases a year, 61 of which occurred in unvaccinated people. This and other examples of vaccine success go to show that if everyone were to receive their recommended doses, we'd have the potential to eliminate the diseases they target. The problem is these vaccines are just so effective, people are forgetting how deadly the illnesses are. Many are more concerned with the rare and often fallacious side effects of the vaccines instead of the disease itself. Vaccination came about because even as first-year medical students, we began to notice the discrepancies between recommended immunization guidelines and adherence to those policies. Vaccination is an efficient, effective, and equitable system that educates and empowers its users to be proactive about their family as well as their community's health. Peter is going to show us more about how vaccination attempts to accomplish this.
So here's the page that users will see when first accessing the website. And let's go ahead and log in the top right corner. And I'm going to authenticate using my Facebook account, which I've already logged into. And this will give me access to the variety of tools that vaccination has to offer. And you can see here on the left, there are tools to look at statistics on vaccines and immunizations locally and nationally, to get information about vaccines and locate clinics in your area, as well as access CDC resources. But the primary vaccination tool is an immunization tracker for you and members of your family. So let me pull up one of the sample vaccine charts. And on the left here, you can see a list of vaccines that are recommended by the CDC for early childhood. And these bars here on the right indicate the appropriate time to complete each step of the vaccine. The stars are steps that have been marked as completed by the user. The red bar is a step that has been missed. And the user can simply click on one of the bars to update the status, whether they received the vaccination, missed the step, or are not sure about it. This is a user-friendly interface to allow users to keep track of vaccines, but is powered by a very extensible and robust back-end system that considers complications like delay times between doses, minimum and maximum age requirements, as well as maximum cutoffs for certain vaccines. And all this is controlled by an extensible administrative input that can allow an administrator to easily add new restrictions, to update the restrictions as the CDC does on a regular basis, as well as add new vaccines that come out in the future. Some of the other tools include the ability for users to add reminders about upcoming steps of certain vaccines, as well as to import data. One of the other features we are very excited about is the integration with the social media component. And you saw earlier that I authenticated the website using my Facebook account. And you can see here, I pulled up some of the statistics on DTaP vaccinations in the nation, showing that 85% have been vaccinated, but the Healthy People 2020 target is 90%. So one thing I can do is go ahead and post this statistic on my Facebook account and share with the world the fact that the immunization rate is lacking and that we should be reaching this 90% by 2012. Now, what's the motivation for doing this? Well, every link that is shared through the vaccination app is tagged with my special referral code, which means that if any of my friends click on the link after I've shared it, I'll be able to find out. And for example, here, you can see a map of the referrals that I've had that have been coming from all over the United States. So I can see which communities I'm having the greatest impact on just by sharing a statistic or showing people the lack of vaccination awareness. I can also see the public leaderboards to see how I rank in my state as well as in the nation overall, and ultimately participate in contests to win prizes to see who can have the biggest impact on the community through social media. All this aims to harness the power of social media, which we have seen before can incite revolutions in countries, but now channeling it into raising awareness about vaccinations.
So all of these features that Peter has told us about are aiming to increase vaccination awareness on a viral level, an attempt to try to combat the growing misinformation that's out there about vaccines. Thank you so much for all of your attention. We really appreciate it. We have a booth in the expo, number 23. Please come back. We'd love to hear your feedback. Thank you.
That was wonderful. Very, very much needed. All right.